So we're going to start off with actually looking at how to triage the eye. So I think with ophthalmology, examination of the patient's really key to getting an idea of what's going on with the eye and then formulating your plan of how to manage it. And it also helps us if you are going to phone up for advice or want to refer a case. If you've had a really good, thorough, systematic look at the eye, then you're going to help us to be able to give you more information, and hopefully we can help you to treat the patient or advise you if you need to be sending it in. So I actually grew up for years hearing my father as a GP answering the phone saying, "Oh, you've phoned the emergency doctor, what's the emergency?" Because there's quite a blurred line of what's an emergency or not, and I think with eyes they can always look quite dramatic, and so it's just a matter of staying calm, and looking at what you're dealing with. Have we got a sudden onset, urgent and unexpected change in the eye? Or is this something that the owner's just panicking about because it looks very visually red and angry, and actually it's something that can be managed on a slower basis, and not as such an urgent need. So ophthalmic emergencies generally involve acute onset of severe ocular pain, loss of integrity of the globe, or sudden loss of vision. We give our receptionists a list so that they can help to triage, but nothing's black and white with eyes. And I think generally the rule is that, if you're in doubt, then don't sit on it, don't sit and wait and see what's going to happen, because the eyes are very finely tuned to maintain a clear ocular media, to maintain vision. And any slight inflammation can lead to scarring and can lead to long-term change in the eyes that's going to be vision threatening, or potentially a painful long-term condition. But these are some of the conditions that we see quite regularly, and particularly the melting ulcers, particularly now that we have such a high population of brachycephalic dogs in the UK. So although we class corneal ulcers as next day emergencies, I would say in brachycephalic cases, I actually tend to be much more cautious, and tend to act on those a little more heavily than I would do with just a straightforward dolichocephalic breed that's just got a small scratch.